Hi, awesome anatomy and physiology students. I'm going to use these slides to talk about HACE, or high altitude cerebral edema. Anytime you hear that abbreviation, that's what I want you to think of, which again is just a more severe sort of stage or form of AMS, or high acute mountain sickness, which we've touched on a little bit before. I did not put these slides together. They were made by Ade Wijaya, who is a doctor. Okay, so let's dive into this. HACE is a severe and potentially fatal manifestation of high-altitude illness, often characterized by ataxia, fatigue, altered mental status. Extreme form or end stage of acute mountain sickness, as I mentioned earlier, progresses rapidly to coma and death as a result of brain herniation within 24 hours, not promptly diagnosed or treated, and it affects about 1% to 0.5% of people at altitudes of 4,000 to 5,000 meters. Okay, let's translate some of that. So again, severe and potentially fatal manifestation of high altitude illness, or again, the acute mountain sickness, AMS. What they mean by ataxia is it's neurological slowness, almost like drunkenness, poor coordination, poor reaction time, that kind of thing. Fatigue just means tiredness, and altered mental status, again, just means your awareness is pretty low. You're not going to be very good at decision making, which isn't good when you're trying to climb a mountain. They say death as a result of brain herniation. Now, what that means is pressure's building up in the skull, and it's going to move the brain. And I know it's a little weird to think, but the brain could potentially squeeze out of a weak point in the blood-brain barrier, or in one of the layers that protects, between it and the skull. Just like, a hernia with your gut is when part of your intestines kind of pokes through some of the muscle. Brain can do the same thing inside the skull. Not a good thing. And so even though this percentage seems pretty low, that's not a very high elevation, and obviously the percent chance of this occurring gets much worse at much higher elevations. So risk factors include prior history of high altitude illness. Some people are just prone to it. Lack of acclimatization, which we've kind of mentioned before, but that means that you're letting your blood cell count increase, your hemoglobin numbers increase, right? You are climbing much more slowly, taking the time to make sure you feel good at each stage of elevation before you go up. Heavy physical exertion, which obviously a lot of mountain climbers are doing. Unfortunately, another side effect of HACE is increased blood pressure. And so if you've got high blood pressure coupled with physical exertion, it's just not a good combination. Again, rapid rate of ascent, which relates to lack of acclimatization, and abrupt ascent to lower altitudes, which is kind of interesting, from lower altitudes, which is sort of the opposite situation, abrupt ascent from lower altitudes is basically the same thing. It just means that you're going from a low, like sea level, all the way to high altitudes. And your reading had a couple examples of this. They mentioned a couple interesting cases with slightly older people who had driven, from sea level to high elevations and went to bed and then woke up with ataxia in some other form of either AMS. They also mentioned World War II pilots who were often flying these unpressurized open air planes, and they were suddenly ascending to heights higher than Mount Everest, so they had to have oxygen and things like that, and to keep them aware and awake. So, okay, pathophysiology. How does this make you sick? Altitude elicits neurohormonal and hemodynamic responses, resulting in hypoxia-induced cerebral vasodilation, leading to overperfusion of microvascular cerebral beds. This leads to intracranial hypertension with elevated capillary pressure and capillary leakage. The disruption of the blood-brain barrier from these stressors leads to subsequent cerebral edema. Everyone got that, right? Great. All right, let's move on. Just kidding. Okay, let's slow this down and break this down. So altitude, meaning when you're really high up, it's going to elicit neurohormonal. That means it's relating to the nervous system and your endocrine system, which is your hormones, and hemodynamic, which means your circulatory system. It's changes in these, right? So it's going to alter the function of your nervous system, endocrine system, and your blood flow, your circulatory system, resulting in hypoxia-induced. That means lack of oxygen, right? Hypoxia-induced means there's just not enough oxygen in the brain. Vasodilation, that means that blood vessels are going to widen because your circulatory system is trying to get more oxygen to your brain, so it thinks, okay, we're just going to send more blood there, leading to overperfusion of microvascular cerebral beds. In short, what that means is the widened blood vessels bring too much blood to the brain. the oxygen just isn't getting transferred. There just isn't enough oxygen in the blood, and so your body's like, all right, well, let's just send more blood to the brain and into the head, but that's going to cause a fluid buildup. So as it said, this leads to intracranial hypertension. That means that pressure is building up between the skull and the brain. That's intracranial, right, inside your skull. Hypertension, again, is just an increase in pressure, blood pressure in particular. And capillary leakage. So I know it's weird to think, we've kind of mentioned this before, fluid is constantly leaking out of your capillaries. Normally it goes into your lymphatic system and gets drained back into your blood. But in the brain then, if fluid's leaking out and building up in the brains, in your skull, that's not a good situation. Just like we talked about how fluid will build up in the lungs with HAPE, right, high altitude pulmonary edema. HACE, high altitude cerebral edema, is a buildup of fluid around the brain. This is going to disrupt the blood-brain barrier, just meaning that, again, exchange of nutrients and oxygen is going to get even harder because there's so much fluid in the way now, and leads to subsequent cerebral edema. Again, so fluid buildup occurs around the brain, and that's the swelling, which is then going to push on the brain. Not a good situation. All right, hypoxia induces free radical formation, causing damage or failure of the sodium-potassium ATPase pump, and resultant astrocyte swelling with osmotic oxidative stress with subsequent cytotoxic edema. Okay, let's try to translate that into English a little bit. Again, hypoxia is lack of oxygen in the brain, right? Your brain's like, hey, we need more oxygen. Induces free radical formation. So by sending more blood to the brain, you suddenly have a lot more molecules carrying oxygen. Oxygen can create what are called free radicals. It's essentially electrons that have fallen off, and you have these highly reactive molecules. It's just not something you want a lot of around sensitive tissues, right? This is why we take vitamins, is to reduce oxidation. Remember that, so these free radicals can damage the proteins, right? The sodium, potassium, ATPase pump, remember those are membrane proteins in your neurons, which are just maintaining the pressure, right? And they allow for signals to be transduced. So this is resultant astrocyte swelling. So astrocytes are just your nerve cells. So think of those as the nerve cells in your brain. They're going to swell up because they say osmotic oxidative stress, which just means that water is going to go rushing in because of this disruption of the sodium and potassium amounts, right? And so the cells are going to swell up and potentially burst, and they could release more toxic fluid into the intracranial space. So this is just contributing now even more. You've got fluid buildup, and now you've got cells bursting and dumping even more fluid full of toxic stuff in and around the brain. Just not a good situation. So clinical presentation, right? What does this look like from the doctor's end? Like, what are they going to see in a person? We mentioned ataxia. Remember, that's just neurological disruption. Like, it appears almost like drunkenness. Severe headaches, difficulty speaking. Lassitude is just constant exhaustion and tiredness. Like even after sleeping, wake up feeling still exhausted. Decline of level of consciousness. Focal neurological deficits, meaning again you just can't focus on anything, can't reason or make good decisions. Seizures, again where your muscles are going to seize up. And again, all of this, it can be preceded by regular acute mountain sickness symptoms, right? Just headache, fatigue, nausea, insomnia. So this is sort of like the worst version, right? This is like, again, this would be the first level, and then these would be the second more severe symptoms. So evaluation in terms of how doctors can potentially diagnose this. They might notice an elevated WBC, that's a white blood cell count. It just means that a lot of swelling is occurring inside your body somewhere. Lumbar puncture, we learned about, right? The lumbar plexus, that's the lower part of your spine. So what they do is they stick a needle into the lower part of the spine, sometimes to relieve fluid. But again, if you see very high pressure, again, it just shows that there's a lot of fluid and swelling happening in the brain and in your central nervous system. Neuroimaging, again, is, MRI, CT, PET scans. Any of those can actually show the swelling in the brain. You'll just see unusual little blobs or something, usually towards the center. Okay, the differential diagnosis. So what this is like, what else could this be, right? So doctors always have to differentiate, like, what are, the 4 most likely causes of these symptoms, and then which one of these is the most likely. So things that show similar symptoms, right? The same symptoms to AMS and HACE might just be dehydration, right? Lack of water. Hypoglycemia, having low blood sugar, again, can have that same ataxia, tiredness, and things like that. Hypothermia, if the body temperature is just low, that shuts down a lot of different things, including the brain, which again can result in a lot of similar symptoms. And hyponatremia, meaning low sodium levels, again, is just going to disrupt the function of your nervous system. So there are a lot of other things that could potentially be confused for AMS or HACE. So management, again, obviously just immediate descent is usually the case to at least 1,000 meters and wait until symptoms improve, but you obviously want to take care of the person as well. Portable hyperbaric chambers, those are like tents and things like that. And supplemental oxygen, that's an oxygen tank. And then they have these drugs here. I added some notes on this lower one. So again, hyperbaric chamber is just a pressure chamber or tent. Supplemental oxygen means provide an oxygen tank. There are 2 drugs that can be taken, dexamethasone and acetazolamide. Now, you can take these via PO, IM, or IV if any of you want to be a doctor in the future. PO means per os, just means orally. IM means intramuscularly, that's the shot in the arm or the butt. And IV, as you know, is intravenous, going straight into a blood vein. Pediatric dosing is obviously much lower. Pediatric is for young people, children. And again, the other one's just orally. Okay, so overall, again, there's a lot of detail there, but what you should take away from this is that HACE is a severe form of AMS, right? So it's kind of like the next stage of acute mountain sickness. Potentially fatal neurological symptoms, again, swelling in the brain, not a good situation, okay? Ataxia, again, that kind of appearance of drunkenness, fatigue, altered mental status, really dangerous, especially if you're climbing on a mountain or if you're in a precarious situation, like even climbing on a wall. Your decision-making, everything is not going to be good and will potentially risk your life and others. Treatment, again, obviously is immediate descent, getting yourself into a pressure chamber that's going to increase the pressure again to help relieve and bring more oxygen to your brain. That's why you have supplemental oxygen too. Again, all of this is pretty much driven by a lack of oxygen in the brain because the air is so thin. And so any steps you can take to get more oxygen to the brain will help. Won't be the ultimate solution though. And again, there's a couple drugs, but again, these are definitely things that are helped with treatment. This isn't something that you could just expect like, oh, I'll just take these drugs and I'll go climb Everest. That's not a healthy approach. You want to train, and again, some people just naturally aren't going to are going to be naturally more prone to these conditions. You have to be aware of that. As your reading stated, a lot of the issues from AMS and HACE arise from people who start getting these symptoms. They feel sick and they're just like, oh, I'm just going to push through it, right? And it's not a good decision to make. So here are references if you want to explore any of these papers. Looks like they're all from about 2014 or back. And I like that they end with a little image of a climber, and I can't help but have this conversation in my head of someone saying, hey, you want to climb a mountain? I'd be like, no thanks. You might fall to your death. No. You might freeze to death. Still no. Your blood pressure might shoot way up. No thanks. Your brain might swell inside your skull. Okay, I'll go. All right, hope this was helpful.